done on a yearly basis. And I have today 3 veterans of SAGE assemblies past. So Elaine Nsoesie, Jasmine McNealy, Sean McDonald. Their bios are all linked off of the website, so I won't repeat those to you. So what we're going to do is I'm going to run through just a little presentation to ground the panel, and then we're going to move into the panel process itself. You can send questions to Zoom webinar at sagebionetworks.org, through the Q&A, or through the Sage Assembly hashtag on Twitter. No guarantees that we will answer any of your questions, of course, however. So let me jump in real quick and just sort of ground us with some starting points. And I'm going to ask one of the participants to make sure we can actually see all this, right? Okay. Because it's not that easy. So first of all, I want to start with our code of conduct. So this is how we do things at SAGE. And so I won't read these out to you. I expect most of you can read these words rather than hearing me say them. But the main point to take away from here is that we do not want any trolling or abusive behavior on this webinar. We will take rapid and non-democratic action if we think that there is trolling happening in this webinar. This is hard and new for everybody. This is not a topic that's even that easy. We're going to deal with some issues in open science that we think need to be discussed, but let's be welcoming and let's be inclusive in the way that we do that. Now, the webinar in many ways comes about because of COVID being really a meteor to the science system. I'm going to go ahead and switch to broadcast view so you can sort of see this a bit better. Is that the correct screen showing, Sean? I'm looking at you. Okay, cool. So, you know, I've spent a lot of my life working on breaking apart the journal system and the data sharing world, and it's been remarkable to see how this has never been a technical problem. It's only ever been a political and a cultural problem. So these are the 923 articles collected in BioArchive and medRxiv that have come out since late December. These pieces of literature are available as a computationally accessible data set, semantically structured, expanded out from those 900 some articles to 45,000 articles, 33,000 with full text. Again, this is something people have been arguing for a long time, but it takes this meteor hitting for someone to actually do it. And what you see all over the place is this graph on a regular basis, which is from NextStrain, which is pulling from open genomic data inside the GIS AID database. And so there's been this explosion of you know, open access to literature, preprints, post-pub rapid peer review, data sharing, data visualization, and open science. And that's been really amazing to watch. It's, you know, it's validated a lot of the things we talk about at SAGE. But it has this accidental side effect, which is that like everyone has become an epidemiologist. And so and I mean this kindly, like I didn't know what R naught meant in December, except for the fact that I had played Pandemic, the board game. And, you know, I was like, what would we find if we looked at it in Google Ngram, right? It's a word that disappeared as the AIDS epidemic began to ease, even in the books. So then I thought, well, how many epidemiologists are there actually in the United States? And so, right, 7,600 jobs for epidemiology in the United States as of the last, you know, occupational BLS handbook survey. And then I thought, well, who are the top posters on Twitter about R naught? And are any of them epidemiologists? And I don't get the sense that any of these people are, right? I'm just guessing here. Some of these look like they might be real accounts. Some of these look an awful lot like bot accounts, actually. And so what's happened is you've got this massive misinformation, right? Some of which is active and some of which is simply people trying to build their influence, or people just trying to get their own stresses out by participating in the pandemic. And this has an outcome, right? So you have, you know, people who are very famous and have high follower counts who are either misinforming, disinforming, or amplifying misinformation and disinformation in a way that's pretty problematic, right? You know, and this has a real impact in policy space. So this is a blog post by a lawyer, right? A lawyer who worked on AIDS, but still a lawyer who, as of March 23rd, predicted 500 deaths in the United States. This has influenced, right, the Trump administration. As you'd see, we already passed that. He posted it on March 23rd. The next day he was wrong. And we're now beginning to go into the exponential growth on this. And this is important because it actually affects policy in this administration. That blog post drove a week of inaction at the policy level. And so we have obligations when we're going to post things and when we open science all the things to think about the institutions that they affect and that they get grounded in. And then the last piece that's really been a big for us at SAGE is a lot of people are trying to open science all the things. And so I owe Sean for this one. Let's see if this works. But this is the most common thing in my world these days. Right? And that is something that, you know, it's not like it's that bad that people want to do that, but these are some of the outcomes that we get when we try to science outside the expertise space in which we science. And so this poor guy, I can't believe there's this picture of him, right? But he was trying to invent a device that would warn you when you reached up to touch your face. And this is not that far from the wearable industry. I know people working on cigarette wearables that look at the same motion. But it's tempting to try to jump into things because we want to feel better about it and make a difference. But it's sometimes we need to stop and say, is the thing we're trying to do useful? And does it work? And what risks does it create? So we have open source ventilator projects. I've got 4.49 million results on open source ventilators. I can't engram Google numbers, but I doubt the numbers were this big in December. I love some of these Mortal Kombat 3D printed masks that you can print on Thingiverse. Then there's a lot of people who are, and I'm going to go back to this. I actually think this is an example of where it kind of works because these are personal pieces of protective equipment, right? The face masks, these are things that actually we can print rapidly that make a difference that the supply chain is failing on. But then we think about what's on everybody's phone because everyone's living with their phone these days. And in particular, I'm seeing a lot of activity around GPS, Bluetooth, and contact list for call tracing, contact tracing, and more. And we're going to dig into what that means. Singapore has actually open sourced its contact tracing tech so that it can be used anywhere in the world. And it's a good piece of tech as far as tech goes, right? It's relatively privacy preserving in a lot of ways. But there are other issues besides whether or not it's privacy preserving and whether or not it's open source. So as we dive into the rest of this, we want to think about what do we know? What do we know from previous pandemics? What do we know from digital epidemiology? What do we know from other kinds of tech? And how can those inform us as we think through this? So we know that misinformation is going to happen. So here's a tweet that pixelates out the words despite scant evidence in a Politico story to amplify it. So people take hydroxychloroquine. We know that phishing is already happening around COVID. So people are getting emails saying, you have got a contact who's been diagnosed with COVID, click here, as a way to drive people to phishing scams. And then we know that there are some basic abuses. Tagging people without permission is something that happens on social media already. Flaming, impersonation, stalking, and phishing. All these things can happen with contact tracing apps and other kinds of surveillance approaches that try to help the common good without baking in protections against these. We also know that too many versions of things can create a fog of war. The lack of data standards in these emergent things can create a Tower of Babel so the data don't play together. Privacy breaches, data transfer to private entities. This concept of creating a permanent state of emergency. Right? I remember when the Patriot Act was temporary after 9/11 in terms of the surveillance that it enabled. And I'm worried that we may be going towards a similar space here. And so these are some of the things that we wanted to think about, right? Is really how do we best use tech both right now during the pandemic, but also in the future? And so that's the end of our slideware, as you're going to probably be grateful for. And what I want to do now is call on our panelists in order. So we're going to go to, and I apologize for those of you, I just saw the comments. I'm sorry you did not get Matt Damon saying, I have one option left, and it's to science the shit out of this. We'll see how it goes on the next one. Now, so we're going to start with Elaine Nsoesie. Elaine Nsoesie is an actual living, breathing digital epidemiologist and is someone who I have followed for a long time to understand how we can track things like obesity on Twitter, the way that the digital epidemiology works in context in Cameroon and Kenya and South Africa. And so Elaine, I was hoping, could you start with what is your day like as a digital epidemiologist? What are the kind of tools and techniques that you use? And what's happening to your life over the last 90 days as everyone becomes an armchair digital epidemiologist?
Yeah, thanks, John. I think most people actually classify me as a computational epidemiologist, which is another term, but my research focuses on digital epidemiology. And basically what that means is that I look at how we can use digital data and tools to monitor the spread of disease, but also try to understand the factors that contribute to the patterns that we see. And we've done a lot of different things, from looking at how we can track the flu using mobile phone data, but also using social media data. What are people posting about symptoms, which I think is the most closely related to COVID-19 in terms of symptoms. We've looked at what people post on Twitter, what people post on, or what people search for in Google, and how that information can be useful in tracking trends of disease, both in the US, but also in some African countries as well. You're on mute, John.
Can you talk a little bit about your recent paper on non-communicable diseases in sub-Saharan Africa and digital platforms?
Yeah, so some of the things we've been thinking about is how can we use some of this data in places where we don't have a lot of data. And we recently published a paper that listed 3 ways in which we can use this data for surveillance. So one is tracking what people are looking for online. So if we looked at people's searches on Google, for example, can that give us information about what kinds of information people have access to? And so this can apply for infectious diseases as well. It's not just non-communicable diseases. So if someone in Kenya is searching for COVID-19, what kinds of information are they looking for on the internet? What might they already know about it, and what might they not know about it based on what you're searching for? And then the second possible use is actually looking at cases. So if someone has symptoms and they're searching online, can we capture that information? And this could definitely be useful in places where we don't have a lot of data. So if we're suddenly seeing a rise in searches for COVID-19 symptoms in a particular neighborhood, that could be an indication that there are people there who are sick and they're trying to understand those symptoms. And then the third use was monitoring misinformation, which we've seen a lot of during this pandemic. So how can we use some of these data sources to understand what people are being exposed to, but also address misinformation in a way that can limit disease spread and help us control epidemics a lot faster?
There we go. Thank you, Elaine. All right, so we're going to go on to Sean. Sean, I wanted to so a lot of, in many ways, this webinar comes out of a chat I was having with Sean, where he quoted the Martian clip that you couldn't hear, but also where we were really talking about, Sean, your experience with frontline SMS, your experience with Ebola and CDR records. So first of all, why don't you say, what is a CDR record? What is contact tracing? And what are you thinking about that in this moment right now?
Yeah, thanks. And thanks, John, for putting this together. It will teach me to have conversations with you. But it's great to connect with everyone. So contact tracing is the process by which we essentially surveil the disease or surveil the virus. And so the way that that is done sort of historically or in most applied settings is when someone tests positive for COVID in this case, you would interview them during the entire known sort of infectious period or the entire potential known infectious period prior to that test, and try and get in touch with everyone that they may have gotten in touch with. And as we know, COVID has some transmission behavior, but we've actually seen that there have been variances in it and sort of edge cases that are leading to real concerns about that. One of the things that's different about a lot of the ways that we're talking about contact tracing now, and particularly again around call detail records. So call detail records, which are CDRs, are the mobile record, the database that mobile network operators keep in order to sort of manage billing us, essentially. They do a few other things, but it is a primarily billing design system. And so through a range of tools, they essentially triangulate your location between the 3 closest towers, the average sort of accuracy of that is about 2 meters, but they essentially keep a real-time or a relatively real-time track of your location based on that triangulation kind of within that generality. So a lot of folks in various science communities have sort of looked at, is there an opportunity to use location data to model behavior around various diseases and viruses, and using what we know, which varies significantly from virus to virus, to help people understand the risks, to help systems understand the risks, and to help and mobilize an appropriate allocation of resources around that. And so what we found in Ebola was that actually a lot of this work is still really experimental. And so a lot of the value, which is really exciting, I think, is still, for the most part, kind of best thought of as useful in highly, in lab settings with the kinds of protections, the ethical and institutional protections that you get out of, overseen experimentation. And what happened in Ebola instead was that there was it created quite a bit of surveillance infrastructure based on the presumption of the value of this data. And because Ebola is a hemorrhagic fever, there wasn't really good data that the phones were producing. And so it wasn't, there was interesting insight to be gained from migratory patterns, but not in a way that was sort of necessary or proportional, and certainly not in a way that was kind of an accurate contact tracing resource during that disease. In this outbreak, we're seeing a pretty large explosion of interest in using location data. The term contact tracing gets used pretty broadly to refer to a range of techniques. I think, there are varying opinions on this one for sure, but I think that we are still in the relatively early days of knowing how to convincingly algorithmically model COVID. And so there are really, the kind of sentiment around it still being in very experimental stages, I think is still one that's useful to carry forward in thinking about how we contact trace COVID.
Great, thank you. So Jasmine is someone who I first found when I saw her paper, Who Owns Your Friends? Which is a paper about trade secrets and social media information. And so Jasmine, starting with what Sean just said about, contact tracing has a lot to do with who owns your friend list. Mm-hmm. And let's, think about what does it mean in a broader cultural context for us to embrace this kind of surveillance, whether it's centralized, decentralized, Palantir or open source. What does it mean? Where does it take us? And what should we be thinking about, once this pandemic is over?
Yeah, so I think it's important. Well, first of all, thank you, John. I think it's important to recognize that epidemiologists and epidemiology organizations like the CDC have been doing surveillance for a long time. What we have now is infrastructure for the kind of surveillance that we don't necessarily want, the kind of surveillance that brings in volumes and volumes of data that can then be used for purposes outside the scope of which, most people would say is okay. So this is beyond let me track COVID or let me track TB, cancer, all those diseases that we don't want. This goes into how people are living their lives. And that is way beyond the scope of stopping, most times, many of these diseases. And so we have tech and science growing exponentially with intentions of helping or assisting. We really need to critically think about what kind of infrastructure we're building with regard to surveillance, and then the impacts it's going to have. Just because we have an intention of building systems for stopping disease, or at least helping to stop disease, doesn't mean that's the only way those systems are going to be used. And also, it doesn't cancel out the very real social dynamics we continue to have. And therefore, we have a history. We know how these things shake out for vulnerable and marginalized populations. And so when you build these huge surveillance infrastructures, we have to really critically think about who's going to be then sucked into the net, or who's going to be disparately impacted by how that data is then used and for what those various purposes are.
Now, Elaine, I'd love for you maybe to take that and pick it up in the context of the work you've done on using, social media photos in Kenya to do food types. So, let's keep sort of pulling through that. And if there's other, elements that you want to pick up on from Jasmine or Sean, we would normally do this a little more organically, right? Because we would be in the same place. So I'm just sort of, try to give you some prompts, but I would love to hear you now, Elaine, respond since you had to go first.
Yeah. So a part of my work is focused on trying to understand what is being represented in social media systems, for example, for public health, where we know lots of people are using Twitter, for example, but not everyone is comfortable enough sharing health information on Twitter. And so we've been trying to understand, when we build disease models that make predictions, who gets captured, who gets left behind. And I have colleagues who have shown that if you predict influenza in different zip codes, you do much better in wealthier zip codes than when you look at poorer zip codes, because that data is not being captured, whether you look at Google searches or you actually look at data coming in from usual surveillance systems that have been run by the CDC and others. Those people just don't get captured, either because they're not going to the hospital or because they can't afford being captured in those systems. So that's something that we've looked at and we've thought about. So when I think about surveillance using these tools, I think it's always important to account for that. And especially when we're talking about places like Kenya, where not everyone is going to be on Instagram posting information, whether it's about food or it's about the coronavirus. So the populations that we capture are not going to be representative of people in those regions. And we're going to leave out a lot of poor people that don't have access to those tools.
And so what are the public health implications of that then, Elaine?
They're huge, because it means we're basically exacerbating health inequalities that already exist in those places. So the rich get to benefit from those tools, and the poor don't get to benefit from those tools. And it can come down to something as simple as misinformation and addressing misinformation. If all the tools we're developing to address misinformation are digital tools, the people that don't have access to those tools are not going to be getting access to that information.
Jasmine, Sean, do you have any responses?
Yeah, well, I certainly, so Frontline's head office is in Kenya, and so have had a kind of front row seat to what's happening there, but they're far from alone. I think it's useful, I mean, to pull on something that Jasmine was saying. I think we not only want to be thinking about the kind of context in which the kind of science happens here, but the context in which these insights or the result of these models gets deployed. I think we have over 200 countries with active cases. We have dozens of countries at least that have declared emergency powers. So the traditional tools that we kind of think of as how we might advocate for rights or correct systems are reduced from normal. And in a lot of places, militaries are being deployed to enforce social controls. And I mean, I say a lot of places. The state of Maryland today just said that they're going to start criminally enforcing social control. So, I think we have to remember that politics and violence can fill the gaps that science creates here, and that we really have to be thoughtful about the amount of uncertainty and the amount of risk that we introduce into places where we don't have the capacity to channel that risk. One of the main differences between approaches to contact tracing is that when you get tested or contact traced essentially by a medical institution or a public health institution, you then receive treatment. You are pulled into the institutional care system. When your neighbor does it, would they harass you a little bit more effectively? We are differently set up to respond to this, and it's important to be making sure that we are channeling and creating information that is appropriate to the institutions, the capacity, the response capacities of the people that we're reaching.
Jasmine, I see you agreeing. Do you have anything you want to add on?
Yeah, so to both Elaine and Sean, I completely agree. One is the fact that all kinds of people, whether it's this pandemic or various other kinds of health or health-related issues that pop up, need to be treated. And we need information, we need data to help with that treatment. My concern, though, is when those outside of perhaps medical ethics, health ethics, systems and oversight create systems that then have a health use, but what's left over is infrastructure for really terrible outcomes and surveillance. While I want, say, the CDC and other health organizations to have the best tools to help stop this and everything else, what I don't want is other agencies and quite frankly, corporate and civil society organizations to have this wealth of data. So like when we build these structures, and if I were to use like a analogy to building a building, like even if that building is no longer used, it's still there. And so somebody could use it. So somebody could take that over and start using it for whatever purpose that they want to use it for. Some changes, some tweaks maybe, but we're still left with this structure that's there. Same thing with these tools, these systems. We are left with these systems that we say like, let's use, for example, let's use our targeted ad infrastructure to do some surveillance during this pandemic to make sure that people are sheltering at home. No, we know that, well, first of all, we know that targeted ad infrastructure it works, but then if it's used for surveillance this way, what's gonna stop corporations and other organizations from then taking that further after we're done, if we're done, right? So these are things that I want us to think critically about when we're talking about let's implement these new tools.
Sean, I think you look like you need to respond.
One of the things I think is really unique about something that is both this global and potentially this long-term in scale is that I think we'll see this happen during the life of the pandemic, right? And so we're already seeing, and I think that, Jasmine points to one of the things I think is absolutely fundamental to pull away out of this conversation, which is that there is a really strong character difference between doing what the sort of absolute minimum invasion necessary to credibly track the virus and tracking people incident to social interventions, because that tracking and those interventions are likely what is going to sort of provide outside guardrails for return to work, eligibility for public benefits, and we're going to see the kind of proxy indicators that we're using become something that not only gets enforced militarily now, but administratively in the way that we kind of re-architect the economy for at least the duration, the interim.
And Elaine, I'm going to go to the open Q&A in a second, but Elaine, I wanted to give you a chance to respond to what you just heard before I went.
Yeah, I agree with the points that Jasmine and Sean have made. I think an important thing to always think about when developing these tools is who's going to use them and what's going to happen during their lifetime. So after the pandemic is over, I don't think a lot of us are thinking that the pandemic is going to end. And so we're just focusing on what happens now. And it's so important for us to think about what will happen after the pandemic is ended.
Yeah, I've been saying to people, they're sort of planning this week and next week. The main thing you can do is just stay home, right? For a while. But there's going to be a smoking crater at some point, right? That a lot of the things we built during the pandemic will be in that smoking crater. And so that's why it does matter that we sort of think about that as we go. All right. So everybody who's listening, first of all, thank you. This is weird for all of us. We're all getting used to us. There's a Q&A function. And so I'm going to start with a question from Arikia Milliken. Hello, Arikia, another Sage Assembly friend. And I'm going to paraphrase some of the questions. So don't the telecom companies already have the contact data? So should the focus be on getting those institutions to let scientists have access to it in a responsible way? Are they playing ball or just pretending like they don't have it and leaving it up to scientists to rebuild the collection systems ethically? Sean, since you are our telco guy, why don't you give us the first version of an answer to this, and then we'll go to Elaine and Jasmine.
So they have a lot of data, and they are, by and large, really happy to play ball. You use the term contact, and I think it's important to just interrogate that. Like, what they have is a lot of location data. What they don't have necessarily is the sort of clear science to map that always to reliable models for transmission. And so what's happening is that it's less about access to the data and much more about how it is that it's sort of being used, how good intentions are being used as a proxy for access that non-telecoms are using essentially to get access to that data and then justify whatever kind of response effort they take.
Elaine, Jasmine?
I think I'm more in support of you looking at aggregated data rather than the individual data, which we know these telecom companies have access to. So if there's been modeling efforts that have looked at how people are moving around and when they stop moving around, how disease spread stops or gets interrupted. And I'm totally in favor of that. I'm not so much in favor of the individual level data and how some people are using it.
Yeah, I think that what Elaine said is really important. Also, I'm worried about the inferences that will start being made from some of this data and how those inferences can be used. And we've seen over the course of history, like how people have just made some inferences that are just, quite frankly, harmful. And then are used to create policies that are even more harmful. So I think that's really important when we think, what's the data that we're getting, the quality of the data, what the data actually says versus how it's being used, and then also how it's being used and by who it's being used. So.
And can I just offer that to Jasmine's point that how you react to how data is collected and who is using it are almost entirely different stances. And so, I think that we want to be really, really careful about thinking about how we engage with that kind of rights enforcement, because certainly during times of emergency, it's a very different enforcement environment.
Right. I mean, so, one thing that we've heard at SAGE is, that a research study is a good institutional structure to contain this compared to some other ones, because at least you're required to do a protocol. You're required to do informed consent, right? If you receive money in the United States, you're covered by the common rule, so a data breach hurts you, right? But one thing that's interesting to me is like expiration dates when you delete the aggregate data, right? So that at least you bend the Jasmine, to your point, like you are no longer able to make shitty inferences once the exigencies are over with, as opposed to, when the data are transferred and there's no expiration date. All right, so I've got another question from Paul Euler. Hello, Paul Euler. And so this is a question that I don't know if we know the answer to, but it's an interesting question. So it says, there is a controversy at the Conference of Parties and the Convention on Biological Diversity regarding whether to include digital sequence data and information within the scope of the Convention on Biological Diversity, in addition to biological materials. Did anybody here a CBD person? This is like the non-trendy version of CBD, right? As opposed to the one that's in like Target. What impact do you think this will have on data access and sharing, especially for research and ABS related to COVID-19? So I'll jump and try to answer a little bit of it. When Paul says ABS, he means access and benefit sharing, which is one of my favorite pieces of the Convention on Biological Diversity, is the idea that if you provide something, if an indigenous tribe provides knowledge or samples out of their local context, that they should benefit and have access to the outcomes of that transfer to typically a Northern Hemisphere, Western Hemisphere organization exploiting it, whether a farmer or not. And so, Paul, we don't know enough to answer this question on the panel. I'm going to try to figure it out and maybe write a blog post. But I will say that the concept of access and benefit sharing in return for individual donation is my favorite part of the CBD. And it's a concept that I think we can think about in the sense of patient communities, in the sense of patient access and advisory groups. And so that's something that I will try to learn more about, and maybe we'll have to have a different webinar on it later. Question coming in from Jason Williams. Americans are focused on privacy and protection from government oversight and overreach. What are our thoughts about mobilizing Americans for what they love to do to give up privacy to commercial interests for the sake of some incentive? With a follow-up that he can't help but see commercial interests building the things that we're talking about, whether they're good or bad, that the pressure of doing something will be powerful on corporations, not just individuals. So, how or can an open ethical platform emerge before ethics-free platforms answer this need? That's a good question. And let's see, Jasmine, I'm going to make you answer it first.
Yeah, I'm not, if I understand the question correctly, it's about incentivizing Americans to perhaps give up some of their data or give up protections to data.
I'm going to try to interpret it. I think if you look at the like that map of spring break phones from Fort Lauderdale that went viral this week, right? So we already do this all the time for like really terrible reasons, like, to get programmatic ads. So, is there a play for us to do this collectively, given that people already hand this information over, or should we have more of a political movement would be I think would be the extension here.
Yeah, I would think that most people who would view that like heat map of the location data on their cell phone would be on the mild side creeped out a little, on the more extreme side, like terrified that they're tracked like that. And so while again, we're talking about intentions, great, we want to track possible spread of the coronavirus and other things as well. I don't, no.
Okay.
No.
That's fine. Like that's and again, this is our first webinar. We're still figuring out how to do all this Q&A stuff. So thank you everyone for being patient with us. I've got a couple of questions that I think, I'm going to send one to you, Elaine. What is from Ido Friedberg. Hello, Ido. What can we learn from countries that are already practicing these sorts of geolocation automatic notifications for contact tracing? So they mentioned South Korea, Israel, and Taiwan. So, is there something we can learn from that?
I don't know that we have enough data to show that it's working. We know they're doing it. We know people are being notified. How exact the precision of the information that they're using, I think it's something that it's not completely clear. So if you're sitting in a train with someone, it doesn't really mean that you come in contact with them, and it doesn't mean that you will get infected because you're in the same train. So sending that information, notification to you can have different consequences. It could encourage you to get tested, but it could also create undue fear and have other effects on you that are not the intended effects. So it's not completely clear how effective these programs have been. We know they exist, but the efficacy across these different countries is not completely obvious.
As a follow-up, Richard Bookman asks, are there any comments on the utility of the data in urban versus rural?
I would definitely say it would probably be more useful in urban areas, just given how disease spreads. Diseases like the coronavirus spread more easily in places where we have a lot of people packed together. So that data might be more useful in those places than in rural areas if people are not too closely getting in contact with each other often.
Well, and this is a question I would have, and then Jasmine and Sean, feel free to jump in, which is, in a rural area, it would seem even easier to enforce social control, right, as an outcome of this.
Yeah.
Your data quality goes down substantially in rural areas because you have much broader tower spread generally. But I mean, you have kind of 6 of one, half a dozen of another problem with the urban-rural divide, because I don't know, I'm sure everyone saw that there was the New York Times piece over the last week that was basically like contact tracing data in New York is pointless because we have public transportation and a super high density. I mean, I think in any time you're looking at a virus where 50% or roughly estimated 50% of the people having it present as asymptomatic, you have the best lessons to learn from places like South Korea and China are invest in testing, invest in enforcement, invest in treatment capacity, protect your frontline healthcare workers, and stay home. And I think that, one of the things that's, we talk a lot about whether or not the data is good for contact tracing, but the advice almost all the time, like no matter what your risk score is stay home unless you need hospitalization, and then only get hospitalization if you absolutely need it. And that's pretty much true in places with tests and without tests. But certainly for the majority of the world that has not enough tests and not enough protective gear and not enough supplies to respond at full capacity, we seem like we're inventing very elaborate flow charts to get to stay home.
Yeah, I think this goes back to the discussion around the use of this technology. So different contexts would have different users. And as Sean said, there are lots of places that don't have enough tests, enough hospital resources to handle the cases that they're expecting to see. So if you're notifying people to go get tested, you're not going to get tested because they don't have symptoms, and they're not in the stage where public health officials are recommending that they show up at hospitals.
I think we also have to really recognize the limits of information here. It's during Ebola, I used to have to, so Frontline was used during the Ebola response to help communities mobilize each other. But one of the main methods of transmission was burial. And, the question ended up having to become, how many text messages from a stranger would it take to convince you not to handle your mother at her funeral? Right? And if you can answer that number, then maybe you have the basis for a useful intervention. But really, this isn't a problem past a point that information solves. And so I think that a lot of times we have to not make that mistake.
So I think what Sean said is really important, is that information is relational. So who do you trust? What are the institutions that you trust? Where is this information coming from? You may trust your friends and may trust other organizations quite a bit less. So when you're getting information, and part of what John talked about at the beginning of this webinar was about the disinformation, the spread of misinformation, where are people getting their information from? And do they trust the sources of this information enough to take action or behave in the ways that are being, they're being told? So one of the, at the very beginning of this, particularly in the United States, there was an email going around and then on WhatsApp as well that, hold your breath for 10 seconds in the morning, and that will help you assess whether or not, you may be infected by COVID-19. And so obviously, no, it has no health, it's not a real diagnostic test, but it was spreading throughout. Why? Because it was being spread by people they may be related to, they may have been friends, whatever the case may be, and there was trust in that. So we need to also recognize the relational nature of trust and information.
So I want to, Sean, pick up on your comment about, so staying at home is obviously not something that people can, well, it's everyone has to do it, but it doesn't create that feeling of I'm helping, even though it is literally the most pro-social thing that we can do right now is just stay the fuck home, right? So but you mentioned responders. And so, that's one of the reasons I did want to call out 3D printing of things like face shields as an actual effective piece of this. So maybe we can unpack a little bit. What are the different ways, can we brainstorm? How can we help responders a little bit here? And Sean, I'm going to put you on the spot.
Yeah, I mean, a lot of it is about making it less painful to help everybody. There are an incredible range of stories of people who, are getting parking tickets, who are having to deal with shift work, who are having to, fashion their own supplies. We clearly, there are lots and lots of ways to activate and mobilize around solving really obvious logistical problems. I mean, I don't know if, there's been a lot of people writing about what tech companies can do right now, and we're seeing a lot of it. I think donating server infrastructure, there's the Folding at Home project, donating your CPU to genomic modeling. But I think that, yeah, so I think that there are lots and lots of.
There was even malware going around that just installs the protein folding software on your computers.
there's been a lot of both funny and also really terrifying reappropriation of like stalkerware to be like disease response software. And that's, you know, I think it's really important to remember that a lot of people are stuck inside of homes or situations or countries where, you know, I'm in the United States, feel like I'm in one of them, that is not always necessarily most focused on my health. So I just think it's worth really sense checking like what versions of this. But I do think that there are all of these kind of social grace pieces, right? Like, seems silly, but finding ways to deliver pizza, finding ways to like cover other people's childcare, finding ways, you know, there are all of these really inspiring communitarian initiatives. So the other thing that I would say is like, if we can move focus from, we need to map the disease as a community, which we kind of don't, because very few of us are as talented as Elaine. And can we map need, right, that we can respond to, right? There have been really beautiful things that have come out of like delivery routes and, you know, helping people deal with loneliness. Like there's a lot of ways that tech can support those things that are not about, you know, cracking the algorithmic model of the pathogen.
Right. So I have a message from just behind the wall from Carolina Rossini, who conflict of interest is my spouse. And so this is Jasmine. I think this is probably going to ask you to answer first. Some tracking maps are being made available by the press. Have you seen any unintended consequences related to these kinds of maps? So elite panic, prejudice, people getting arms to protect their neighborhood, or is that something that we should be worried about?
Well, I think it's certainly something to be worried about. Before COVID, it was something to be worried about, right? So you had whole neighborhoods being labeled undesirable. You had like actual apps dedicated to that kind of foolishness, which would like basically sink property values for certain whole areas of cities and places where people wouldn't drive their cars through because somebody said this is the ghetto or whatever the case may be, right? So there are those before COVID. Post-COVID, I mean, like, or during, I could definitely see that. Even if we say that a city like New York, we look at what's happening with New York right now, and we see that states on either side are saying we're going to close off our borders to people from New York who have a New York license plate or we know are coming in from New York. That's a label being attached to people based on their geography or where they're from. And so that is quite frankly, it's going to continue to be a huge issue. I think in Texas too, they're doing it, right? They're closing off the borders with people from Louisiana, or specifically New Orleans, but Louisiana. So we're having both a constitutional issue that's about to happen right now, but also a labeling or a data-based issue. So may not be the most digital or technical data. It is data, your license plate, your ID, your, you know, your zip code. Yeah, it's going to be a problem.
Thank you, Jasmine. So Elaine, I have one more question for you, and then I'm going to do a big open-ended question to help us go home with. So this is from Julie McMurray. Julie, thank you for everything you did on flattenthecurve.com in the early days. I just want to say we see you, we thank you. So one of the questions, and Elaine, this is because you've actually been studying these things for a long time, which is, you know, how do we ease back in after staying at home starts to be, you know, only part of the question. So if contact tracing is important in the early parts of the curve, or is or isn't, right? Like, what do we do? What are the kinds of computational epidemiology tools that can help us as we think about, you know, reopening the economy and getting back to work when we know there's going to be reinfection?
I think that's a question that I don't know if we're ready to completely answer those points because we're still learning a lot about the virus. I think there's been recent reports that people that were infected in China and recovered and then tested negative and now are testing positive again for the virus. And there had been previous assumptions that we would have some immunity at least for a while, but it's not clear whether that is true, if that differs for different people. So I think there's a lot that we still don't know and we're learning about the virus. So making decisions about how we should go back to life as it was before, it's something that I don't know. I don't completely know like what would be the best way to approach that. But I'm hoping that as we get more data in the coming months, that's something that we could start figuring out.
Thank you. And actually, I'm going to do one or two more of the other questions before the big one. So Khadija Ferryman, hello, Khadija Ferryman. What does the literature say about the effectiveness of opt-in SMS health information during pandemics? Because she's worried about what are the opt-in options, and do these strike a balance between privacy and receiving trusted health info? Anyone know?
I'm going to assume that one's, well, I don't mean to assume, maybe other people have spent a lot of time doing this.
Sean, go for it.
Yeah,
We'll critique you after you speak, don't worry.
Please do. I expect nothing less. No, so what we see is that there are a lot of really effective pieces, but you have to understand that a lot of, I mean, as you do, I'm sure, the social calculus that goes into the opt-in is a lot of the sort of hearts and mind part that we're talking about here, right? So to Jasmine's point, you know, it's relational. By the time you've chosen to opt into something, you're kind of choosing to accept the relational sort of authority of, or the kind of integrity of the information that you get from that source. So the sort of research is good, but it's not necessarily instructive at how to create that kind of trust and how to build out those kinds of really effective public health messaging relationships.
Elaine, do you have any experience you want to bring in?
I think it's been shown to be useful for some cases, depending on what we're looking at. So what is the purpose of the SMS project? What is it for? So is it just to notify people of the fact that there's disease in their communities, or what is the exact purpose? So it's been shown to be useful for some cases, but again, it depends on the question. What question are we trying to answer?
Like everything else, it's best when attached to care.
Right.
Yeah.
Yeah, so Christine Suver at Sage, who leads our governance team, has a sign on her door that just says, "It depends," right? And so for every question we get in governance, we just sort of start with that. All right, so I'm gonna end this with Elizabeth Ramirez. Hello, Elizabeth. With a big open question. Does the present situation and circumstances change the way that any of you thinks about the best data governance models going forward? So let's see, who wants to volunteer for this big, scary question, or should I stall?
I'll do it.
All right.
For me, no, it hasn't changed. In fact, I think it's edified what I thought about the need for a completely different data governance model, if we even have what we can call a data governance model in the United States at all. But I think we really need to consider what data is, particularly as it pertains to individuals and communities, but then also what are the structures and the political, social, legal environment in which data has to resides, and the systems through which they go through. And also all of the kind of organizations and structures that will then have access or can have access to this data. So what I've said earlier about like the infrastructure that's being created or and the intentions behind it, we really need to look at that infrastructure and see who all can use that infrastructure and use that data. And so I think in this time where people are more able to be persuaded to be lax about being vigilant about how and who collects data and uses that data, I think now more than ever, we need to be really vigilant about what kind of structures we allow to be put in place to collect human data.
Sean, do you have any?
Yeah, I mean, I mean, ever since freaking out about this in 2014 around Ebola, I've been kind of on this, you know, trying to chase down some version of this. So, you know, it hasn't really changed a lot of what I think about data governance, but I do want to be really, I'm going to keep making this point for as long as people will let me talk to them. But a lot of what we're talking about here is data that creates social license to do other things. So like the surveillance that we're talking about is a set of harms unto itself for sure, but the things that people will do with surveillance capacities are significantly more concerning. And so a lot of what's happening is that science is being used to grant social license. And that's happening in tandem with the declaration of emergency powers, which lessens the kind of requirements for that sort of social license to begin with. So I just, there's so much of what we're talking about here that I think is that we need to be really clear about the integrity of the systems that we have that are designed around ensuring the quality of the science that we build, the due process rights that we have to challenge authorities. Even if it doesn't always happen immediately, I think that we can't lose that these things are happening. So as you know, Elizabeth, I'm a big fan of data trusts. I think it's a great way to build kind of communitarian infrastructure. And I think that given the amount of political instability that we're seeing, communitarian infrastructure is a great way to focus attention.
And Elaine, in the end of this, it's got to work for you because you're the person we count on to actually interpret this. So I'll sort of give it to you to give us the last word. What's the kind of data governance you need to be able to do your work the way you want to?
So it's definitely important with collecting the data. And that's not new. It's something that we've been talking about for a while, but we already know that the individuals will have a lot more data than they should have. And then the question becomes, how do we use this data in a way that would benefit society without exacerbating the issues that we already have? So how do we use data to create tools or answer questions that would, at this point, limit the spread of the pandemic while making sure that we're thinking about future implications of how that data is being used?
Nice. So that takes us to, 2 minutes before the hour. If you're like me, you have Zooms all day and you need 2 minutes to pee here and there. So I'd like to say, first of all, thank you, Elaine, Jasmine, Sean, for being such amazing panelists. They're all on Twitter. You can follow all of them. If you look at the Sage Assembly hashtag, you'll find them. I'd like to thank Xiaoqing at Sage Bionetworks for putting this together for us. And we at our peak had about 148, I think, participants. And we're still at 122. So I'm glad that you are all gluttons for punishment. And if this works, we'll look at the feedback and hopefully we'll do this again soon with some new topics. Thank you very much for joining us. I am John Wilbanks. This has been a Sage Assembly webinar and we are grateful. Thank you so much.